we know that patients with COVID-19 infection are at increased risk of thrombosis. And in our article, we show that first, arterial thrombosis related to COVID are associated with a high risk of death. And second, that elevated D-dimer at M3 may help to predict arterial thrombosis and recognize high-risk patients in the setting of care. My name is Karim Sacré. I am a professor of medicine at the University of Paris in France, and I am currently working as a clinician in the Department of Internal Medicine at Bichat Hospital in Paris. I have co-authored this manuscript with colleagues from almost all the departments of medicine of our institutions that were involved in the management of COVID patients during the first wave of infection in France in April 2020. The title of the manuscript is Arterial Thrombotic Events in Adult Patients with COVID-19, and it will appear in Mayo Clinic Proceedings. As said, patients with COVID are at increased risk of thrombosis. This is a very important topic given the great pandemic and the high morbidity and mortality known to be associated with thrombosis events. The purpose of the study and the article was to focus on arterial thrombosis in COVID patients. We aim to report on the incidence and risk factor for arterial thrombosis in all admitted patients with COVID in a referral center in France over 1 month. First, we observed that around 6% of patients with COVID experience arterial thrombosis, including stroke and myocardial infarction, but also for 25% of them, very unusual arterial thrombosis, such as thrombosis of the aorta, thrombosis of renal arteries, or multiple microarterial thrombi. Second, arterial thrombosis happened around 10 days after the first symptom of COVID infection, and usually occurred in patients considered at high risk for arterial thrombosis according to traditional risk factors. Third, in-hospital mortality rate in such patients was very high and reached 40%, meaning that arterial thrombosis increased the risk of death by 3-fold in COVID infection. And finally, a high level of plasma D-dimer measured early after admission was associated with the occurrence of arterial thrombosis. Elevated D-dimer levels at admissions are known to be associated with increased risk of mortality in COVID infection. In a study, D-dimer level was also independently and strongly associated with arterial thrombosis. According to a finding, the D-dimer levels at admission may help to identify patients at high risk for arterial thrombosis and guide preventive treatment such as anticoagulation. Both the high proportion of unusual arterial events and the high risk of deaths are suggestive of a COVID-19 specific arterial vasculopathy. The next step will be to better understand how COVID infection acts as an acute second hit in patients at already high risk for cardiovascular events according to traditional risk factors, and to test intervention to prevent arterial thrombosis in COVID-19 based on the D-dimer level. We hope that you will enjoy reading this manuscript and find some clinically useful information that may help clinicians dealing with COVID-19 infected patients. And do not hesitate to reach us if you have any further questions.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.